Hey everyone, thanks so much for coming back to my channel. I'm sorry it's been a little bit of a lag in getting the next video up, but I've been running around from hometown here in Toronto to Ottawa for my full-time job, and with things opening back up with the pandemic, I just find that work is picking up and everything else, so apologies for the wait. But I thought that today we could go over that same-day surgery packet that I received during my surgery consultation. If you haven't seen that video, I kind of walk through the before, during, and after of my surgery consultation for endometriosis. And if you haven't seen that video, I highly suggest you look at that first before this one, because this is just a follow-up video to that experience. So I will link the video down below in the description box, but for now, if you've already watched that, let's dive into what was actually included in the same-day surgery packet that I received. Okay, so the first thing that is on the admission instructions to patients same-day surgery packet, this is for the Scarborough Health Network specifically. So for myself, it includes what hospital I will be going to. It just has a little checkbox on the actual packet itself, as well as any contact information for the hospital itself. So that's just what's on the actual envelope that holds all this information. So the first thing that I see is payment of hospital fees. It's like the number one thing that pops up. It just says supplies and services that may not be covered by provincial health insurance can include canes and crutches, fiberglass casts, breast pumps, foam walkers, CDs of patient imaging from diagnostic images. So it's just an outline. You know, I feel like this is a general packet for any type of surgery. So for endometriosis surgery specifically, I don't think I will need a breast pump, but I do think this is good to have, you know, just to cover their bases of, you know, prepare for your surgery. This is what we as a hospital are not able to cover with provincial health insurance, or what your provincial health insurance may not be able to cover. So these fees apply to all patients. You may be asked to provide payment for health services and patient registration at the point of service. So that's just something to keep aware of. So it's good to know, because before your surgery, you may be thinking, oh, like my provincial, for myself, it's Ontario. So my provincial health insurance may be able to cover this, and then I go into it, and then at the end it's actually not. So this is actually good to have, just to be aware of, okay, I may be having to pay out of pocket for certain things that I may need after my surgery. The next thing that's included is just a surgery notification. So it just looks like this, and it's instructions for myself. So before going into my surgery, it says here that I will need to do blood work 7 days prior to my surgery date. No eating or drinking after midnight before my surgery. And again, if I was instructed to take oral medications on the morning of my surgery, I can have a small sip of water with this. It says, please arrive at the hospital 2 hours prior to the scheduled surgery time. And that makes sense, to be able to be there ahead of time and to check in and do all the things I need to do. So because I am having my surgery during the global pandemic, it just says a COVID-19 test must be completed 4 days prior to my surgery date if I have not had 2 doses of the vaccine. And then it says here, you can be exempt from taking the test if you've received a second dose, or if you do have an exemption due to allergies or things like that from taking the vaccine. One main thing that they do have here is to ensure that someone is able to drive me home after the surgery and to stay with me 24 hours after discharge from the hospital. So good to know. I won't be driving myself back after a laparoscopic surgery. I think I'd be in too much pain. So that's good to a support network with me to take me to and from the hospital that day. The next thing that's included is laboratory use. So it's just a form. I don't know if I can show it properly here, but it's just a check mark of what I will need to do. And it's just a blood work form. So that's included for me specifically to outline to the Bloodwork laboratory when I get my blood work done to outline what type of blood work I need. So that's important too to have. The main thing here is patient and family guide surgical journey packet. It is pretty thick, and I've gone through this. It's just the ins and outs of, you know, what to prepare for. So welcome to your surgery journey. And this is the page that it looks like. It's kind of going to be backwards, I think, for you guys, but just a nice general page. Hospital care team is here for me if I need it. a page where I can write questions for staff at the hospital. So that's nice to have if I'm thinking beforehand, you know, if I have any questions, it's good to have them prepared ahead of time. Just setting up too before surgery. So staying active and healthy before surgery, managing my medications, taking vitamins and supplements, you know, my pre-admission appointment. So making sure I bring my booklet, this one with me, going to my appointment, exactly how to check in. So they have an outline of each hospital in the Scarborough Region Network. And for myself, I can look at the specific hospital that I'm going to and see exactly how I check in. So for instance, one of the hospitals here says, walk by the Tim Hortons. It literally says that. Walk by Tim Hortons. Tim Hortons. Like, very Canadian of them to be like, you're gonna have to walk by it. You can't have any because you have to have like a little sip of water before your surgery, but you walk by the Tim Hortons and you're gonna be fine. Reviewing medications, and then patient tips, so getting ready for surgery. So arrange for a coach, which can be a family member, to help me through the journey, identify who can make decisions on my behalf if needed, arrange for someone to drive me from the hospital, you know, have a surgery bag ready, prepare meals in advance, which is good to know, complete house and yard work ahead of time, arrange to have someone who can help with household chores. So little things that you may not be able to think about prior to surgery. It's good that they've outlined that here. Day of surgery, it just says, you know, times to arrive, what to bring. So this booklet, your coach, which is like a family or a friend to help you through, you know, comfortable clothes, rubber-soled shoes, non-skid socks, stockings, hand sanitizer, toiletries, and a small container if I have dentures, which I don't. So no container needed there. But I have read too, I'm not going to be able to wear my contact lenses, so I will have to pack my glasses, and that's something to keep aware of if you have contacts as well, that you can't wear them during surgery. Arriving for surgery, you know, before going into the operating room, I will have to go into a gown. My care team will review my vitals and my charts. I'll have an IV put in, and my, you know, I'll be asked to go to the bathroom ahead of time. So this booklet is just basically the ins and outs of the logistics of getting prepared once you're at the hospital specifically, and then after your surgery. So they have a little section here too, and that's just making a safe recovery, checking in on my pain scale. I'll have services in your room, a TV. I get to watch Food Network, which is amazing. And yeah, so just other things too, like if I have allergies, let them know, any pain, I have to communicate with my team. And then here's the risks. So for here, it has, you know, blood clots, and that's what, you know, my other video I had during my surgery consultation, my surgeon did outline that blood clots are a higher risk for me because I am on birth control, as well as this type of surgery can relate to blood clotting. So that's just something to be prepared for. And they have here how to prevent blood clots. So let your healthcare team know if I have a history of blood clots, move my arms and legs regularly, drink lots of fluids, and tell my healthcare team if I noticed increased warmth, pain, swelling, or changes in skin color in one leg or arm, or sudden chest pain, lightheadedness, or shortness of breath. So again, knowing ahead of time that these are the warning signs I need to look out for after my surgery. Pneumonia is a kind of infection in the lungs, so it's important after surgery to make sure that I'm, you know, practicing good mouth care, especially cleaning my teeth, keep my head above my bed, get up and move around. And head up above my bed, I mean like maybe just sit up is what I think they mean by that. Get up and move around and do deep breathing and coughing exercises as instructed by my team. Yeah, so this is just the booklet. It's just the logistics of everything, symptoms to look out for, fevers, pain that's not controlled, redness, swelling, vomiting, differences in bowel movements, and then the discharge checklist. So once I'm done my whole stay at the hospital, they have, you know, what time I should be ready to leave the hospital is something I should ask my team. Are there any special instructions for recovery? Are there changes to my meds? Are there changes to foods I can eat? And things like that. So this booklet is very general. I think they give it to everyone going into a surgery within the Scarborough General Health Network, which is where I will be going for my surgery, which I'm very excited about. Okay, something that I did forget that was also a little blocked in the package was the Department of Anesthetics. So patient information about anesthesiology and anesthetics. So it's just outlining who is my anesthesiologist, do I choose my own anesthesiologist, what are the types of anesthesia, can I choose my anesthetic, do I get a needle, how do I go to sleep, why must I not eat or drink before my surgery, what do I do with my medications, and are there any risks from anesthesia? That one just says any kind of treatment in medicine has risks. Risks vary with the existing medical condition of the patient and the type of surgery that you are having. The best available and appropriate monitoring, anesthetic equipment, and drugs are used. The chance of serious adverse events is very rare and minor side effects may occur. If you have further questions, please contact your healthcare team. So just a general, again, pamphlet about the anesthetics going into surgery, which is nice to have. So I think this would have been a lot of information to take in right after my surgery consultation. If you have watched that video, again, it was very overwhelming and anxiety inducing. It's been a couple of weeks now since that consultation, and I obviously feel fine to look over it. I feel like I've processed information. I'm feeling, still okay about it. It's November 26th right now, 2021, and I still feel really positive going into my surgery. It is a bit daunting, like I said in the previous video, because again, I don't want to be having to make this decision about my body for something that I didn't anticipate my life journey going. But here we are. It's something that I'm ready and have come to the mindset of. And, having that time to take the couple of weeks to absorb that general information was needed for me. And now I'm ready to, read through this packet and look over the payment fees that I have to do for my hospital visit. But overall, if you're going through your surgery consultation and you've received a booklet like this, feel free to read it over when you have the time and headspace to do so. Please don't feel pressured to read through something right away when you know personally that you're not going to absorb the information. This is just a quick run through of what was included in my specific package. I am not sure if there are other things included in different hospital regions across Canada or in different countries. So you might have to do different things to prep for your surgery. So just keep that in mind that this is very Ontario specific and very region specific for me in Scarborough, like the Toronto general area. So I hope that was helpful. Again, it just included payment overview of what to expect out of pocket, how to prepare logistics wise before, during, and after your stay at the hospital, as well as my blood work that is going to be needed 7 days prior to my surgery, and that's specific to me. So I hope that is helpful, and all the best to you in your surgery consultation journey. Please feel free to comment down below how you're feeling about your journey so far, how you're feeling about surgery options, and whatever you want to put down there. This is an open and safe place to voice your thoughts and your feelings about the journey, because it is very daunting at times, and we're in this together. You're not alone. I'm in it with you, and I can't wait to talk to you on the next one with my surgery consultation journey.